Hello, this is Dr. Wells with Wells Medicine, and I wanted to address the topic of trauma and ketamine treatment. So a lot of patients will ask us what the best treatment is for trauma or PTSD. And from my perspective, if it is just pure PTSD, pure trauma, I really prefer stellate ganglion blocks. If the PTSD is kind of comorbid or commingled with depression or anxiety or OCD, then I'm much more inclined to suggest ketamine treatment. A lot of patients who are doing ketamine treatment worry that it's going to bring their trauma back up. We don't see this. So, not to say that it's not possible, but unless patients have a very specific intention of reliving the trauma, or journal or meditate or work with their therapist to go back and relive the trauma, for most of our patients who are listening to quiet music and engaging with medication, it's just a very floaty, comfortable experience, and they aren't actively seeking to go back and relive or work through their traumas. Now, we do have some patients who do choose to engage in the work of consciously bringing back up their trauma and working through that process in the clinic and engaging with it here, which is fine. That is a very reasonable thing to do. I always suggest that those patients as well have therapy within a couple days of a ketamine treatment, just so they have assistance and help with the processing and the integrating of those memories, and with that trauma-oriented work. And I highly suggest, it's called a trauma-informed therapist, so a therapist that has specialized training in trauma as well. We have had some patients who, because of their CPTSD or their PTSD, they've had a stellate ganglion block and then done ketamine infusions to try to work through more of their mental health issues with the PTSD kind of softened or decreased from the stellate ganglion block, and we recommend that as well. That's a great option. But the short answer is we don't see trauma coming up for patients during a ketamine infusion unless they're consciously making the decision to invoke that trauma and to work on it during their ketamine infusion.